Okay, let's start. Good afternoon, coaches. All right, welcome to this e-workshop series that CoachSG has scheduled for all of you. All right, so if you have followed our workshops, you realize that we started this series of e-workshops with developing your digital capabilities, such as designing the coaching session, how to come up with the home-based learning resources, introducing different types of digital platforms that you can use, building your coaching profile, etc. All right. If you have missed any of these sessions, you may visit our CoachSG Facebook, all right, to view these sessions. All right. Due to the current situation, many of us coaches have not conducted any physical training session or met up with your athletes or team for a period of time. So therefore, it is important for coaches to understand injury prevention and management, and also to think about gradually bringing your athletes or teams safely back to training when physical training resume, given that their fitness and conditioning may not be as strong when you last saw them. All right. Today, this workshop is on coach's role in acute injury. All right. Before we begin, maybe let me introduce to you today's presenter. All right. So today's workshop will be delivered by Ms. Yo Hui Kun. All right, she's the team lead for the sports medicine and senior sports physiotherapy in Singapore Sports Institute. She has worked with elite sportsmen for more than 10 years. Prior to her career as a physiotherapist, she was a national fencer, and her passion for sports medicine and sports science and interest in sports development led to her pursuing of a physiotherapy training and subsequent working with elite athletes. All right. Before I hand this over to Hui Kun, can I get all of you to mic your phone? Yep, or your laptop. And if you have any question, you may post it in your comment, and we will address this at the end of the session. For those who are on Facebook, you may also post your question in the comment, and we'll take it from there. All right. Over to you, Hui Kun.
Okay. Thank you. Okay.
Sharing.
Hey, good afternoon, everyone. All right. Now, today's session is my third part of the four-part series. Okay, talking about sharing about some first aid and knowledge for coaches. Okay, so the last two sessions we actually look at injury causation model, and also looking at how we can actually prevent injury, and also looking at various types of injuries. So today's session we're going to address something more a little bit more hands-on. It's about acute injury management, which I think most of you would more or less encounter during your coaching session. You know, what should you do? You know, having an athlete or participants which suddenly had a traumatic event, or, you know, if in fact even an incident where it feels very they are unwell. Okay, so this is just a recap. So when we talk about coach role in athletes healthcare team, you know, we covered part of injury prevention. Last week we looked at injury recognition. So today we're going to look at some of the first aid care, right? So just look at this slide itself, okay? During different sporting events, right, things can happen, okay? Incidents can happen, accident can happen. And each sporting events do carry all its unique risks, and they have its own emergency, right? Being it's affected by height, affected by environmental condition, or it could be even man-made, all right? So during a trauma in sporting events, okay, you're looking at injuries or illnesses that's related, that can happen during sporting events. It can involve athletes, it can be involving yourself, other sports officials, spectators or bystanders. Sometimes it involves one person. At times, it can also involve a group of people, okay? The severities can vary from something very mild, like, a knot, which you can run it off, to something that can be quite life or limb threatening. Okay, so I'm sure some of you do encounter this, someone down at your sporting event on the field, okay, or some a little young participants, crying in pain, or it could be someone coming to you and telling you that I feel very unwell during your training session. So the immediate response is, what should I do, right? Okay, so one of the components, a few components within acute injury management would be that, first of all, if you want to help to manage the acute injury, you need to know what happened. So you would need some form of assessment, doing a basic assessment to look at how severe or how badly affected is this participants affected by an incident. Okay, and that with that you gain an outcome, and with that outcome, at least then you can actually think of putting in an action plan, or you could help to supervise management plan. Okay, now, so coach role during injury management, acute injury management, is that firstly you need to rapidly do a rapid initial assessment. Okay, you need to actually find out what exactly happened. Okay, and then with this assessment, you find out whether how severe it is. Okay, is there any limb or life-threatening incident? Okay, and then the next thing is that you minimize your further risk. So you want to prevent this injury from worsening. The next thing is to determine a safe return to training or competition. Okay, now, not all incidents would be that, after a collision, for example, or an incident of trauma, for example, you sprain your ankle, where you would, be able to go and tell your athletes, you'll be okay to go back, or you're not okay, without an assessment. So it is quite important to assess so that you can determine your action plan and whether these athletes can continue with your activity that you have planned for that session, or you have to actually sit out, because by continuing to participate in the planned session, that their injury or the condition will worsen. Okay, and lastly, you need to ensure that your athletes receive appropriate intervention pathway eventually, to ensure that they recover fully if they really get injured, right? So when we talk about injury, or we talk about trauma, I would put it into 4 different categories. All right, if you look at this blue boxes, these are the 4 main categories. Okay, first of all, is that life-threatening. What is life-threatening means is that if nothing is being done, we're not giving help to this athlete, an athlete would basically die eventually. All right, so an example of life-threatening events would be things like cardiac arrest. Okay, it could be due to a severe trauma event that affected the spinal cord, or what we call the spinal cord injuries, or it could be some form of head or internal organ injuries, right? The next thing is limb threatening. Limbs being that, is there a bony fracture? Is there a fracture of the legs or the lower limbs, or is there a fracture of the hip, or is there a fracture of any of the long bones, right? For some of these sporting events, okay, there may be a risk of them losing the limbs, okay, in terms like, for example, your high-risk sports, for example. Now, the next category is that you look at systemic malfunction. So systemic malfunction usually refers to incidents that affect your body system itself. It can be illnesses, all right? This athletes or these participants come to your session with already feeling unwell, or that they have just recovered from a bout of illness, for example, and they may not be the fittest to participate in your activity. It could be due to some traumatic incident, for example, collision or not, that actually affect their systemic system itself. Could be internal, okay, it could be things like just stroke, okay, it could be heat stroke itself, like because it's environmental factors, or some form of hypothermia. So, you know, exercising in too extreme coldness, for example. Okay, the next one, the last portion is what we call functional limiting. Okay, so this is something that we usually encounter of all these four categories. What you mean by functional limiting is that these traumatic events actually affect your functional movement, and usually it can be due to musculoskeletal injuries, or it could be due to concussion. All right. So in such events, what is the appropriate immediate response from a coach? Right. Now, the next thing is that before I continue, at the end of this session, the takeaway, if you can take away actually 6 words. All right. These 4 words are the first 4 that you will take away with it. So 4 acronyms of STOP, Dr. ABCD, and PO and TOTAPS. The last 2 falls under acute management, which we call it peace and love. Okay, so how does these 4 words interrelate with your response to an acute injury, right? First of all, we look at STOP itself. So STOP means it's an acronym of STOP. What it stands for is stop, talk, observe, prevent further injury. So this STOP is an immediate response if you witness or you see a traumatic event, being something very severe of, you know, a collapse in the field, or it is just an ankle sprain, or just being plain fact that the athletes or the participants is feeling unwell. Okay, we all use the first thing is to stop and find out what exactly is happening, observe, and the next thing is that with this observation and this assessment, you will most probably come up with a plan. All right. So if you look at this STOP, so you stop the activity, you stop the athletes or participant from moving, you start talking to them, all right, and ask like, what happened? Okay, tell me, how are you feeling right now? Okay, and then you observe for, it could be danger, it could be the response of this athlete or participant itself. Are they in distress? Are they in pain? Are they, you know, disoriented? Or they're just basically not responding to you at all? With this feedback that you get, then, you know, you go in to plan for your next action, all right, which is P, prevent further injury, and start planning for the next action. So what happens when you finish with this P, okay, then there are 3 outcomes that you get. Because when you stop the activities, you start talking to your athletes or you're checking on them, you can actually have 3 different outcomes. Okay, 1, they are not responsive at all. You know, when you talk to them, say, are you okay? They're not responding to you at all. They can be responding, or they can tell you that they respond, but they tell you that they feel very unwell. So with this 3 category, you can actually decide what is the next level of assessment. For someone which is non-responsive, you know, we goes into your primary survey, which means that you need to do your DR ABCD. So which is your cardiac resuscitation. Okay. If it is someone who is responsive, then we go into checking on them, looking at what we call a secondary survey. And with this, you use the acronym TOTAPS, T-O-T-A-P-S, right? If it's someone who tells you that they feel unwell, they are shivering, or they feel chill, or they feel nauseous, for example, these are the ones where we goes into doing a focus history, which will use the acronym AMPLE. Okay, so if someone is unresponsive at all, so this is something that everyone is familiar with. So if it's not responsive, what you would do is go in and do your DR, S, A, B, C, D. All right. And usually with this outcome, if they don't regain consciousness, or they're not responsive to you after your assessment, your decision will be stop activity, discontinue, ask for medical help, send them to the hospital immediately. Okay. And so this is straightforward. The next thing is that when someone comes to you and say, Coach, I feel okay just now, but right now after my run, and I feel very short of breath, or I feel, very uncomfortable, right? So these are the things where you would use focus history, and you would ask them using AMPLE. So what does AMPLE means? Would be that first A, you ask that if they have any allergies. So are they allergic to anything? Is this an allergic response? Okay. If this is someone that says that, yes, I do have allergies, and this is usually how I react to an allergies. So we know that, okay, this is something that has happened to them before. Is there a strategy for them, or do they have a strategy to manage this? Right? Are they on any medications? So if this is a long-term medication, or is it just a dose of medication for a recent illness, for example? Because we know that sometimes having medications, do actually give them some side effects, and that can affect physical performance. Whether they take it or they forgot to take it, both have impact on that. The next thing is that, do they have any past illnesses? Are they asthmatic, or do they have any other medical problems? And is these symptoms a response to their illnesses? The next thing is when is their last oral intake? Okay, whether it's a solid or liquid, because you will ask if this is a reaction to a bout of food poisoning, or is this a reaction that they just had a prolonged period of not having any solid or liquid intake? Okay. And lastly, it is, do they have an event? Have they experienced this before? Okay. This kind of symptoms. Now, if we look at it, and that if they answer yes for any of this, all right, which at times you would think that, okay, if they have a coping strategy for this, and this happened before, and they do have a strategy to do this, maybe we allow them to execute their strategy first. Maybe take their medication, or take their Ventolin inhaler puffer if they're asthmatic, and observe for any worsening of condition, or observe for that their symptoms more or less stabilized or got better. And only in the event that they did not get better, that's where, a consideration about a discussion with them to say that maybe, since that we have observed and monitor you and it's not getting better, then at least, we can actually advise the athletes or participants and say, maybe for the good of your health, we should actually, you should actually go and seek medical consult immediately. At times where they have gotten better, right? And then we still, advise them to say, okay, maybe you do not need to rush to the hospital, but you still need to continue with your monitoring, and in the event that you get worse later on, maybe you should reconsider seeking medical help again. So at least this would manage your participants and your athletes' anxiety, right? But at the same time, not panicking to have an event to say that you send everyone feeling unwell to the hospital immediately. Okay. Now, the next one that we talk about is a secondary survey. This is used quite often, okay, and it's quite commonly used in a lot of sporting activities. Okay, so what is a secondary survey? The secondary surveys means that it is a TOTAPS. It's usually referring to a lot of how we assess acute musculoskeletal injuries in sporting events. Okay, so how do we approach this? So of course we would use a systematic approach where you look at TOTAPS. So you start with T, the first T, as in talk, where you would start talking to your athletes, right? So when you talk to an athlete, what you want to find out, it is not asking, that just a chit chat with them. So you talk to them to actually find out what exactly happened. It could be that they're responding to you and say, I twisted my ankle. I have pain on my knee. I have pain on my on my back, and that you may want to find out, like, okay, how did it happen? Was it a collision, or was it just an awkward landing, or is it just due to a quick sudden change of direction, for example? And while you're finding out what's happening to them, you also observe for symptoms. Okay, you observe how they feel. Are they nervous? Are they in a lot of pain? Are they disoriented? Or are they feeling? Or you observe for the environment. Okay, is there any danger that poses danger to you and to the athlete or the participants? Are there broken, open wound? Are there deformities that you noted on the athletes or the participants, etc., etc.? Okay. Now, with that, after the observation, the next thing, if you identify that there is an area of pain and that you see that there is no swelling, but that the athletes, but there is no deformities at the same time, but the athletes is in pain, you may want to just do a gentle touch and palpation around the injured area and then slowly move on to the affected area. Okay, with that, if a touch gives you an increase in their symptoms, then you know that, okay, how bad is that injury? Yes, it looks like it is a sporting injury. It is painful to touch, but how bad is it, right? So if after that, after the second T, we move on systematically to say, okay, it's painful. I know, your knee is painful. Let's see if you can move your knee yourself. So, what you're looking for is that whether this participants or these athletes are able to move, okay, the affected joint or affected area actively by themselves. While you check on this, what you are observing is this athlete able to, firstly, get full range of motion through this range, right? Or did they actually increase this? Is there an increase in pain when they start to do your active movement? All right. The next thing is, if you think that they tolerate very well with active movement, there can be pain, but they're still able to go through full range, then maybe the next thing that you want to try to help them is to say, let's see if I give a little bit pressure to the joint okay, what will happen? So you go through a passive movement. Okay, so you help and says, okay, maybe now you have the athlete seems to be able to bend the knee through range and its full range. Let me see at the end of a range, when I put some pressure, what will happen? Now, if it is really very painful, you know that, the athletes most probably can still tolerate range of motion, but may not tolerate anything beyond, okay, a gentle active movement, which means that maybe, okay, the athletes may not be able to perform all functional movement, right? So the last thing that you do is to do a skill test, okay? A skill test to test them to see if the pain or the injuries is affecting their functional movement. Okay, so why do we want to actually find that out? Because first of all, we want to determine whether, okay, is that just a mild injury? It's just a knock that the athletes can still perform their movement normally with pain, or is that some trauma and some structural damage that with their active movement and their skills movement, okay, that results that is affecting them not performing to their normal skills movement. And with that, that if we get them to return to their sporting activities, you are going to make them worse. So the difference between yes and no, okay, lies with within this TOTAPS, lies within A, P, and S. Okay, so when we look at A, which is active movement, and if our athletes is able to move the injured region actively, full range, they may have a bit of pain, but the pain is not stopping them from going through full range actively. Then, we can actually move it down here to say, yes, they are able to move actively, full range with mild pain. We move on to P, as in passive movement. Now, if an athlete cannot perform an active movement, then it would be something to say, I'm going to stop my assessment. I'm not going to continue my assessment because it cannot go beyond active movement. And so we come to a no here, right? The next thing is that if an athlete can perform active movement pain-free, but with over pressure from a passive movement, it starts to increase pain, for example, all right, then you gotta, and it is pain, very pain, there is an increased pain with passive movement, right? Then we're gonna move them to say, nope, they're not safe to continue assessment, and we got to take them out, okay? Now, in the event that they have active movement, they tolerate very well with passive movement, then the next thing that we're gonna do is do a skill test. Okay, how do you run this skill test? Basically, very simple. Now, it depends on which region is injured, okay? Usually, I would differentiate it into lower limb or upper limb. At times, because for the trunk itself, I can always use a combination of lower limb and upper limb. Okay, so if someone injured lower limb, what you want to see is a progressive manner. Are you able to weight bear? Which means, are you able to tolerate your own body weight? If you are you able to walk? And if you are able to walk, are you able to run? Are you able to stand on a single leg versus double-legged activities? And if you're able to progress, then the next thing is more dynamic activities. Are you able to hop? Are you able to jump? So if your participants or your athletes are able to continue to progress this skill test without much problem and without a lot of complaint, then you would know that they are pretty safe to return to their activities. it doesn't look like the injury, it is very severe, that is affecting their functional movement. But in any point of time that, during a skill test that you see that they're able to walk, but they run very awkwardly, they are not able to go on single leg activities, then it is something where you consider they're not able to complete my skill test. I'm going to say, no, I'm going to move them over to this side. Says that they're unsafe to return to activities. And if they actually are able to finish your skill test, and their pain gets better while doing the skill test, you know that, okay, that is the injury or that incident or the impact is not severe enough. And so it's pretty much safe for them to return to their sporting activities immediately. And maybe with that, you just want to observe and supervise, and at any point of time that it wasn't, you can take them out. But if your athletes cannot perform active range of motion, they cannot tolerate, or they cannot tolerate passive range of motion with overpressure, or they're not able to complete your functional skills, these are that group of athletes which you tell them, look, you are not able to do all these things. So I would think that because of that, it is very unsafe for you to return to your activities, which means that you have some form of injuries, and if you continue your activities, it's going to make you worse. All right, so I need you to stop your activities, and that we look at how to manage your injury. Okay, for skill test for upper limb, would be something very straightforward, that you want to look at full range of motion. You want to see how well they tolerate overhead activities. So overhead activities would be things like throwing, catching. All right, you want to look at their push and pull factors and see how well they tolerate all these activities. If they are able to throw and push and pull and catch, okay, normally without actually a compensation of movement, then that would itself be deemed they're safe to return to their activities, and you do not need to rush to actually say you're unsafe. But of course, while you allow them to return, always remind them that if it gets worse, please let me know. And because if it gets worse means that you are not tolerating well with the activity stress. And that means that if you continue, you will worsen your condition. And that's where you get them out. All right. So the decision for TOTAPS, right, is for that whether you want to find out whether, firstly, if the athlete is safe to return to play or even compete following that incident. Okay. If it's yes, you continue to you can allow them to return, but you need to monitor and you need to reassess after the physical activities of the session. If it is no, you need to stop the activity. In a competition setting, you may have to find a substitution. You may have to withdraw this person from the competition, and then you have to provide an acute injury management immediately, and that you decide on the continual injury management plan or do appropriate referral, right? Okay. So a recap of these 4 keywords for assessment, okay? First is your immediate response, that you want to stop the whole activities to find out what exactly is happening and so that you can plan the next step of action. Okay, your outcome of this thought could have someone that is non-responsive at all. It could be someone feeling very unwell, or it could be just someone responsive but telling you that they have pain because they had injured part of their limb or part of their body. All right. So with that, then you would decide which other assessment to do. If it's unresponsive, you have to do your DRS ABCD. If it is illness, you do your AMPO. And then if it's TOTAPS, you would, if it is musculoskeletal injuries, you use TOTAPS. With the objectives of this assessment, firstly is to find out one, okay, how severe is this? Two, what is my next plan of action? Do I have to send them to the hospital or get immediate medical help? Or do I can monitor them? Could I provide some acute injury management, and that, you know, they could actually follow up with medical help later on at the end of after your spotting session or the next day following your spotting sessions. Okay, so this is the main thing about your assessment. Okay, you are not going to be a doctor or a physio trying to find out what injury it is. At this moment, you know, you may know that it is an ankle problem or it is a knee problem, but you would not be having a diagnosis of what exactly happens to the knee yet. But what you know is, at least, okay, my athletes could still be safe to walk home or to take a bus home and continue with some acute management, and that if it doesn't get better in a day's time, okay, they can still go to seek help. Or it is something that it's very severe that you need to tell your athletes that I need you to go and seek medical help immediately, because it looks like if you do not get help now, you will get worse. All right. So this is the objective of the acute injury assessment and management. Okay, not to take over the role of the doctors or physio, but to actually help your athletes, okay, approach how do they manage their injury, right? So with the assessment, okay, a lot of time, if it's not responsive, DR, A, B, C, D, you would have to leave it to medical help immediately. For illnesses, or, you know, if you use AMPO and it's for illnesses, you know, you would be the one, you wouldn't be the one, you know, knowing what exactly is happening to them, because that's the role of the doctors to find out. But what you could do is to ensure that they get help if they have never experienced such episode before, and that if it's due to their illnesses or the medication that they usually take, then they actually have a coping strategy to it, right? And that you could monitor. Where else for musculoskeletal injuries, right? It is something where you want to think about, okay, if it is a musculoskeletal injury, what should I do next? Okay, so the next half of this session, we're going to talk a little bit more about acute injury management of musculoskeletal injuries. Okay, now what we know is that when you have a spotting injuries where you sprain your ankle, or, you know, you strain your hamstring or you strain your calf muscle, what's happening is that we talked a bit of this last week, where it says that, you know, there is a traumatic event that caused a shearing injuries to your soft tissue. Okay, so with that impact, what happened is that the blood capillary within the soft tissue, whether it is a muscle or it is a ligament, okay, breaks. And that's where, you know, because of the broken capillaries, you know, bleeding starts to happen. Now, with that, you know, the inflammation process starts. Okay, so with that broken capillaries, there would be swelling. Okay, there would be secondary self-death, and your body react to having inflammation reaction to start the repair, process. All right. Okay. So the thing is that it's quite common. A lot of you, you know, when someone injured, you yourself injured, that you do not know what to do, or you know, you see an athlete's getting injury, first thing that what you do is you go and say, oh, okay, acute. You Google and you put in acute injury management. Okay, so what comes out of this Google search would be, you know, they show you a lot about ICE, about this 3-word ICE, I-C-E. But a lot of people, or a lot of the public actually had misunderstand this word ICE. You know, everyone thinks that acute injury management just apply ICE. The word ICE actually represent 3 components. Okay, 1, ice, icing; 2, compression; and 3rd is elevation. Okay, so it is not just about icing itself. Okay, now then, you know, if you search further, okay, maybe some of the more recent website will tell you it's no longer ice, it's actually rise. You know, you need to rest the injured area, you need to ice it, you need to compress it, and you need to elevate it. Okay, the thing is that, why do we need to rest? Okay, so the proposed theory about resting is that, you know, you want to allow healing to happen. You do not want to stress the injured structure that cause further injury. Okay, you want to ice to reduce swelling, to reduce bleeding, and also to reduce inflammation. Okay, and also you want to use ice as a pain management effect. All right, and the next thing is compression. You want to compress to manage the extent of the swelling. Right, and then elevate, especially for your peripheral limbs, is that you want to facilitate blood flowing back to your heart, so that you can actually get increased drainage and facilitate good nutrients to the injured areas for repair. Okay, now then, you know, from ice it becomes rise, and then the next phase is that someone put in to say rise is not enough. We need to actually improve the management better by using the word price. So they add a P in front of the rise, which means that, what does a P means is that to protect an area. Okay, the protection, which is something also to further prevent further damage of that area. So a protection could be things where you look at protect could be things that you use a crutch to offload your lower limb or your injured area. It could be a brace that you wear for your ankle or for your knee injuries to prevent your the further injury or movement into painful region, right? And then, you know, from price, then you realize that, oh, it is not enough. We can actually improve the whole management better, and that's where, you know, a team of clinicians starts to say, you need to have a price, use price, and do not use no harm. Okay, so what it means is that you need to protect, you need rest, you need ice, you need compress, you need elevate. Okay, but you cannot do this. No heat, no no alcohol, no running, or which means strenuous activities, and no massage at the acute stage, right? So, and then after a while, they still find that it's not the most ideal approach to address acute injury, because with a lot more evidence base, they realize that actually, you know, there could be a better approach to acute injury management. So this is the second last recent approach, where they take off quite a number of things. They take off rest, for example. They didn't encourage, not saying that they encourage harm, but they do not emphasize on no harm, but they put in things like this. They still keep the icing, the compression, and the elevation, but they put in optimal, they replace rest with optimal loading. So what it means is that there were evidence to show that complete rest may not actually help with the whole recovery process, because you actually take away some of the healthy loading that would facilitate healing. Okay, so what would they say? What they put replace the rest with the optimal loading. Optimal, what you mean by optimal loading would mean to say is that move as tolerated, move in a manner that do not make your injury worse. So for example, if someone sprained the ankle and a painful movement is going on tiptoe, all right, but they are okay, there's no pain with walking, then the advice is, yes, you can walk as tolerated, but avoid, anything that goes into what we call ankle plantar flexion, or what we mean by standing on your toes, so that we do not actually put the movement to an extreme of no loading at all. Okay, so then after that, there was this team of researcher again, we start to evaluate what is police, okay, optimal, when we scrutinize the purpose of P as a protection, optimal loading, ice, compression, elevation, and that there were a lot of research review to it. And then, what was found recently is that when we review icing as an acute injury management modality, we find that, the ice, rise, price, you focus a lot on just managing the symptoms. So during the acute management, you actually ignore the subacute or the chronic stage or the later stage of tissue healing, okay? The other one, it is that the randomized control trial. So a lot of the research shown that had provide not enough evidence to determine the effectiveness of rest, ice, compression, and elevation therapy for acute ankle sprain adults. Which means that what it's being said is that everyone is actually following the whole process of rise, price, or ice because they were told so, okay? But when we actually look into the outcome of using ice, price, and rise, okay, as your acute injury management modalities, it doesn't seem to give you the outcome that you really want. Okay, and the next thing is that one thing about that when we realize about ice and also any form of anti-inflammatory modalities, for example, taking anti-inflammatory medication, okay, seems to help with pain management. So it can reduces your pain from the injury, but it actually has potential harmful effects on the optimal tissue repair and healing. What it means is that what we have been using ice, okay, as an acute management strategy, okay, what you're doing is to numb the pain. But in this process of numbing the pain, okay, and that in this process that you are actually using ice on a very frequent cycle, for example, you ice every 2 hours, no doubt you can reduce your pain, you help you manage your pain, but the side effect is that it actually delay your process of tissue repair. Why is that so? Okay, the reason is because ice, having an anti-inflammatory effects, okay, where we say that inflammation is necessary to start tissue healing, and that if you use ice, and ice has an anti-inflammatory effect, which means that ice would delay inflammation, then you are actually delaying the whole, you are actually slowing down the whole inflammation process, or you're even stopping the whole inflammation process to kick in. And with that, without this inflammation process, you're not going to start your tissue repair. That's some reason why you would see that for some athletes where their injuries are quite a high-grade injury, and that they rely solely on using ice as a management modality, okay, you would see that the whole healing process outcome tends to be quite draggy. Wouldn't say that they will not recover, but it's just that at times they take a longer time to recover as compared to somebody else. Okay, so this is quite a concern from what we found out from a research setting. Okay, so with that concern, a team of researchers actually recently proposed it this way and look at the whole acute injury management, and then came up with a suggestion to say, we take what is good with the previous approach, and we include what is lacking but is good for what is lacking from previous approach but is helpful with acute injury management. So it came out with the next two words that you would need to remember for this whole session: peace and love. Okay, so this new proposed acronyms actually is to optimize recovery. So it is not just about acute injury management, but also to optimize the whole phase of recovery process. Okay, that includes rehabilitation from immediate care to the subsequent management of returning to sport. Okay, so this whole peace and love is just not about asking all our athletes who injured or who have acute injury to ice. Okay, it is a whole education process to actually tell them that it is a process of how you actually manage your injury from an acute stage to a full recovery state. Okay, and so what does this whole peace and love means? So one, of course, we still retain the protection. Okay, if at an acute stage it is too painful to move around, all right, and that if you rely on a crutch or you wear a brace that can provide a support to the injured areas, we go with it. We provide some protection. All right. We also protect it from other strenuous activities that can worsen the injured area. Okay, you want to elevate, because elevation is a good way, especially for lower limbs, it's a good way to facilitate blood circulation and to bring good nutritional circulation to the injured area to start your repair, right? And that to drain off the fluid and swelling that's accumulated around the injured area. The next thing is A would be something that is very new, that's not found in previous management in ice, rise, and price. It is avoid two things. Avoid anti-inflammatory modalities. Okay, anything that has anti-inflammatory purposes, we should avoid during acute stage. Acute stage would means it's the first 24 hours to 72 hours of your injury, depending on the severity of your injury. Why is that so? Because you do not want to delay, you do not want to stop the inflammation process. You may want to manage and prevent excessive damage from the inflammation process, but you do not want to stop and you do not want to delay any inflammation process. You just want the inflammation process to start, but in a manageable manner to allow healing to happen. So avoid anti-inflammatory modalities. And what are these? Okay, avoid anti-inflammatory medication, avoid icing, okay, because these two can delay your inflammation process and which eventually leads to delayed healing. Okay, the next thing is we still continue to compress the swollen region. Okay, this is how we would manage the excessive side effects of an inflammation by allowing swelling, but do not allow excessive swelling. Okay, and then the next thing is to educate. To educate and to actually provide, okay, the correct and appropriate knowledge and information about acute injury management to our athlete. Educate them to say that, you know, when you get injury, this is what happened. And in order for you to ensure that you recover fully from your injury, this is what is needed. You need to actually provide acute injury management. You also need to look at the rehabilitation process, and that's how do we, you know, what else do we need to do to ensure that eventually you are fit to return to your sporting activities, and that also that you have done enough to prevent the recurrence of the injury. Okay, so it's a whole process of education and ensuring them that, you know, it is a process. It is not just about icing. Okay, the next thing is that, you know, that piece would address, you know, the whole acute injury management. The next part of it, the LOVE, L-O-V-E, look at the rehabilitation process, or what we call the subacute or the chronic stage of acute injury management. So first of all, we tell them that, yes, when you injured, you know, certain part of your structure is affected. It's painful with walking, but, you know, loading wise, okay, too much load is going to worsen your injury. But if you do not load it at all, it's also going to affect your recovery because your structure, your injured area do not get stimulant, okay, to actually kickstart, okay, to address the whole adequate healing. So you may have structural healing, but you may not end up with adequate functional healing. So that we would actually advise on loading, okay, to tell them that cannot not load it, but there is optimal loading in a way that you need some load to stress your joint or your area, injured area, to allow growth and healing to happen. But it cannot be too much that delay the whole healing process. So optimal loading is important, but, you know, everyone's optimal loading is different, and the optimal loading is different at different phase of your recovery. And one of the safety advice to give to an athlete is your movement has to be pain-free, and it should not be painful with that specific movement. It has to be a progression. So, you know, you start with something more stable, double-legged first, and then you progress slowly into a single leg or in the slightly higher loading activities like jumping or hopping or a quick change of direction, right? And then you actually instill optimism in them because, you know, we know that, you know, sustaining an injury is a determinant for people to discontinue with sports and physical activity participation. So one of the things is to instill a correct information to them, and also to actually give optimistic, make them be more optimistic. Acknowledge that it can be quite scary, it can be quite painful with an injury, but always advise and always encourage and reassure them that if they get proper management of their injury, and if the injury management is adequate, okay, they can still return fully to the activities that they enjoy. All right, that they should not be avoiding or they should not be discontinuing with their activities, because physical activity as a whole has a lot more health effects than just their injury itself, right? And we also know that pessimism is actually one critical component that delay recovery or to actually achieve optimal recovery. So we want to actually avoid that and prevent that from happening. The last thing is that to actually tell them that it's still important, it's still safe to actually go for pain-free movement activities. So if walking is not painful, walking is tolerable, but running is painful, yes, we avoid running for the time being, but you do not need to be so extreme to end up resting in bed for 10 days just because running is still painful. Because you can start walking and walking is actually still tolerable or it's pain-free. Now, you need to actually tell them that with active physical activities, right, it actually provides, active, more dynamic blood circulation within the body system itself. And that vascularization actually helps with the healing. Okay, so which means it says that you do not need to go into a total immobilization of your injury. Okay, you can allow some pain-free early mobilization. Any form of pain-free aerobic exercise will also improve your system, and that actually helps with recovery. Okay, and lastly, in the whole rehab process itself, do your adequate rehab exercises to address the dysfunction and the limitation that's caused by the injury. We know that if it's a ligament sprain, it can actually affect some joint instability. Okay, so adequate exercise to address that instability or that dysfunction, or an adequate exercise to address the weakness of a hamstring following a hamstring strain, okay, is important. Okay, so with that, okay, we come and combine it to say that, so the recent model of acute injury management would be called, which involve two portions. One is the assessment of the severity of the injury. You want to find out what exactly is happening. And the next thing is to provide acute injury management. And what does this involve? Involve peace and love, okay, which means you want to actually protect your injured area. You want to do some elevation, avoid anything that actually delay tissue healing, which is anti-inflammatory. You want to do some compression to manage the swelling, educate the person, ensure optimal load, be optimistic, and then have enough exercise to address blood circulation and also to address the dysfunction resulting from the injury itself. Okay, so the implication for coaches would be that you play an important role in this whole acute injury management, not to be a doctor or physio and try to diagnose what's happening to your athletes, okay? Is to first, because you would be likely the first person to witness that incident, that injury, so you would likely be the first person to determine the severity, and so that you can help with the follow-up of the management, whether you want to get your athletes to stop the activity and get medical help immediately, or advise them on some form of management so that they eventually can get some medical assistance the next following day or thereafter. You also want to ensure that they get adequate injury management following their injury. Right? So my point to note is your immediate response is not to be a doctor, it's not to diagnose the injury of your athletes, but is to determine the immediate needs after their injury, whether they need immediate acute medical attention, or you could provide some form of acute first aid and injury management, and then ensure that they follow up with the subsequent management to eventually return to the activities safely. Okay, so with that, I end my session here, and I'm actually open for question.
We could, in the interest of time, I think maybe we will just end this, and then
Okay.
we'll take questions
All
after
right.
this session. Yeah. For those coaches, for those who have questions, maybe you can stay back after this session, and then we'll be sharing we're answering the question.